morning, everyone. Thank you for taking your time to come and be with me and my team. It's a cold day. It's a Thursday morning. You're busy people, but you chose to be here. And so I'm really grateful. My name is Angela Nguku. I am a rural girl with a purpose and a passion that came many years ago when I worked in the post-conflict South Sudan immediately after university. And I think that is where I got the change, the desire to really speak out and speak up for those who could not speak for themselves. And I'm glad because you're joining me in that cause that was formed many years ago. I founded White Ribbon Alliance in my heart a few years ago. And 6 years ago, it became a big movement, and that's why we are here today. I'm really excited to see a lot of you, my friends. You become my friends in the cause. At least I feel like I know almost everyone in this room, from my former colleagues, friends, champions, and people who are committed to advancing the cause in your big or small way. By the way, I'm a believer that everyone has something to give, even if it's a smile. And so I believe you are here because you've committed to do that. And so why are we here today in the interest of time? White Ribbon Alliance is a movement that works from the grassroots to the global to connect and to amplify the voices of those who are rarely heard. When I walked in here, I was sad, but I was happy at the same time. Sad because these are not just statistics. These are not just numbers. These are not just stories. They are real people with real hopes and aspirations that were cut short. And as we are speaking today, we lose on average, they say 17, that is according to the Kenya Demographic Health Survey. But from what I've seen and what I've heard, we are losing more than 26 women every day in this country. I don't even want to talk about the newborns and the stillbirths because they are never counted, most of them. A lot of times you are told you'll get another baby. And so just going to the field and listening to these stories makes me happy again because this was a dream that we had with great colleagues like Angel, Sandra, who is seated here, and many other people in the team today, Lillian and all that, to basically tell the story and call for change. A lot of times we hear people coming to tell the story of them, but we are here because we want to bring the stories to you so that you can continue telling the stories and allowing them to speak up and tell the stories for themselves. At White Ribbon, we believe in what you're seeing here. We ask women and girls what they need. We don't prescribe. Because one person has said here that it has been a long time, and I think is the RH coordinator for Bungoma, that since she started working, the statistics have been the same. But I want you to ask yourself, how much money has been invested in maternal health? How much money is set aside for women, economic empowerment? How much money is set aside for so many of these? And I'm not talking about just government money. I'm talking about development money, millions. How many meetings, even if I'm just to look at this hotel today, are discussing issues to do with women's health? How many conferences? Someone made a joke a few years ago that the hotels in this country are partly for tourists, but mainly for development sector, because that is where the money is burned. And I am as guilty as charged. We're here today. But the story is, the question is, why are we not changing anything? I'm sure if I ask you today, if you know someone who has lost a child, had a miscarriage, or lost a wife, a mother, a sister, anyone to childbirth, all of you will tell me that you know. And by show of hand, how many of you know people who've died in childbirth or during pregnancy? It's almost a whole room. Some of us are directly affected, like my brother said, and my other brother here. Some of us have seen them, witnessed them in our practice, but there's nothing we can do because the system has chosen to shut its ears and eyes. But there's so much. Most importantly, how many documents, how many policies and programs are being set aside? We are always developing programs. Processes are so many. conferences and frameworks. In 2 weeks' time, we'll have the United Nations General Assembly taking stock of the toll of where we are. I don't know how much money is going to be spent in New York on first-class flights and so much. New York is too far. Let's talk about this country. But women are still dying. Newborns are still dying. Families are left distraught. I want you, as you are here today, we are going to screen the documentary. Just a few of the mothers that we've talked to, and many more. Our work is very simple. We ask, we listen, and we act with women. We make sure when we are screening, we are asking the questions. We remind them that we are going to take the stories to others and come back to them to act with them. And so our flagship work that is founded on the Ask, Listen, Act approach, we call it the power approach, are the campaigns, the What Women Want campaign. What do women want for quality care? They have told us they want respect, they want economic power, they want so much more. What are the lived effects of climate change, COVID, conflict, cost of living? What do newborns want for respectful care? And so much more. And so we are launching those reports today, and you'll see them, including case books of stories of women, newborns, families, and everyone who could speak to us to tell us what is happening. And so today, I don't have PowerPoint presentations. I'm not going to tell you about Angela or White Ribbon. I want us to listen to them. It's their day. We promised, and we want to deliver. But most importantly, it's not just listening to another TV documentary. It is listening and acting. Because honestly, I don't want to imagine what happens when you lose your wife, you lose your sister, you lose your friend, you lose a neighbor and anyone to childbirth from mostly preventable causes. We know the solutions, by the way. We just lack the will to do the right investments, the will to make it a priority, but most importantly, the will to make it our business, because until it affects us, it's never our business. You might ask, but where are the big wigs in the room? You are the big wig. Because everybody, I chose and I made a commitment, and I do the work I do every day, and I am sure I'm contributing to a change somewhere. Wherever you are contributing, and you are the big wig in that space. Because it is out of making it a big wig's problem that the problem has persisted. But once we make it everyone's problem, the problem will be halved. And so today, I celebrate you, and we join to celebrate you as you come here to honor the women, the newborns, the families, the friends, and everyone who has lost their life in the process of bringing forth life. But also have that hope. I hope you've gotten this ribbon. The ribbon, the white ribbon, and people ask why are we called white ribbon? It's because white, we don't want to just be in dark, in black, because black is like gloom. But white, at least in white, there is hope of a better tomorrow. And there is peace in knowing that we can make a difference. And so as you are wearing this ribbon from today henceforth, please commit to making a change for them. As I end, because this is not my day, neither is it White Ribbon Day, it's a day for women and newborns and you and everyone else. I really want to call on us, as we listen, let's remember, it is not just numbers. These are not stories. These are real people who had real hopes and aspirations, who had families, and who had a chance, but we failed them. You failed them, I failed them. But we can change that tide, because the only thing that is left in this world today, as my former colleague Sandra said, it is that hope that it can be done and it's possible. I am doing it every day by waking up to come to White Ribbon Alliance to work, and you're making it every day. But please, let's make it our story, because their story is our story. It might not be today, but someday it will be if nothing happens. So I want to take this moment to welcome you. Enjoy the day. It is not going to be, it's not, don't want it to be a day of gloom, but a day of hope that everything is possible. And together, we can make that difference. Thank you and God bless you.
Habari zenu. My name is Frederick, or I call my name Fred. My name is Fred. I like using Fred most of the time because Frederick is so English. I'm one of the, let me call myself a victim first so that we put this into perspective before I become one of the champions or the unofficial champions or ambassadors of maternal health. I'm not the official one because nobody has made me one yet. But because of the situation we've been in before, there's a lot to learn, or there's a lot to talk about in my own capacity or as a representative of those that have been through this situation before. I don't know where to start from. Is it the question and answer, or I give my story first so that we can have the question and answers later?
You can give your story first.
Yes. Now, what happened on that fateful day, or the days preceding that? It was a journey that I was looking forward to, and my friends were also looking forward to. Sababu, we had, allow me to use English and Swahili? Yes. We had been looking forward to having this baby with us. We had done a lot of photos, the baby bump photos. That was like 2 weeks before she passed on. And these photos, I created a sensation for myself and for those people that were also looking forward to having the baby together with us. Little did we know that what was awaiting us could be a life-changing experience or a life-changing event, because we had done everything right. Everything was done right on our part as the father and the mother to our newborn. She always requested that I escort her to the prenatal clinics, which I always did because I had the time to, and this was the first baby that I was looking forward to call my own. So I had to create time and learn to be a good dad. I used to do this every day until that very day that she passed on. So when we went to some hospital that we had preferred to have our baby delivered there, or our baby born, it's an hospital, I can't remember the name. I sing in a church at St. Stephen's Cathedral, Jogoo Road, and our pastor had recommended that hospital. We had visited it earlier, at least once, for the prenatal visits. And everything was good. Everything was good. The pressure was okay. The baby was okay. The mother was okay. We had done everything right. Everything was done right. Except on that day, we had gone earlier. I can remember it was a Wednesday. We had gone to that hospital, and they said this baby is too big. So rather than wait for it to be an emergency, they referred us to either Pumwani or Kenyatta. But they didn't tell us we should go immediately. We are from that hospital. Because I was also, in that, being that I was following up on the dates and everything that pertains to the baby and the dates they are in, nilikuwa nimejua by this date we should be having our baby or we should be somewhere near the hospital. Nikamwambia now dates zimefika, usikii any pain, because she didn't show any signs of discomfort during that week or the week that preceded that week. So we went back home from that hospital where we were told that the baby was too big and that we were given a referral to another hospital. And a few hours later, ndiye akaanza kukuwa na those discomfort. I asked her to go to the hospital, twende pamoja. But that was around noon. Around noon. So nikaenda na hospitali Kenyatta. I didn't carry everything else with me, the NHIF card, the Linda Mama. I had just carried the book with me. Ilikuwa ndo Linda Mama, I think. So tukaenda, and we were told we are okay now that we've come to the hospital on time and there were no complications that necessitated a serious attention. Mi nikarudi nyumbani to take care of, my wife had another baby from another marriage. Wanasema ukinunua ng'ombe unanunua pamoja na kamba. So nilinunua ng'ombe pamoja na kamba yake, my wife and her beautiful daughter from another marriage. Alikuwa nyumbani, so I had gone back to take care of her, kwa sababu that was around lunch hour. She should have been back from school, because alikuwa bado msichana mdogo, around class 3. Ndio nimtengeneze lunch since the mother was not there. So tulikuwa tumekaa pamoja na yeye, the baby girl, until jioni. Tukakaa akalala. Me being uncomfortable now that nimeacha somebody that I know, and I was looking forward to having the baby, nikaenda to go watch some football somewhere. But it didn't click to me that something was right until a few hours later, around 8:30 thereabout, something was not right. Because earlier tulikuwa tumeongea naye akaniambia nenda theater because pressure was a little high. I made the last call and they told me it's already kumekucha already, unaweza kuja hospitali. So that uone mgonjwa wako. So mimi nilikuwa tu okay. I waited for the morning. I prepared the little one, nikamwacha na jirani because nilirauka around 6. Nikamwambia ikifika 7 mpeleke shule and then unifungie tu mlango if I don't make it in time before lunch hour. Now that following day ni macha food pale, utampatia tu akule. But as fate will have it, my wife had passed on around 7, according to 7 in the night. So hata hizi calls nilikuwa na make around 8:39, walikuwa shampelekadi kwa morgue, because mimi nilimpata kwa morgue at KNH, not even somewhere where I could decide on which morgue I want to take her to. I had a lot of questions to ask, but that I didn't have the energy at that moment because I didn't know what to do. I only had one photo that I had not posted yet. She had a white dress. Unajua two ladies, those baby bump photo that two people take. Kuna moja ilikuwa exciting. I was to post it, the last one, to thank her for bringing my baby to this world. I posted it, yes, because that was the plan, but with a different message of unfortunately not making it to this world. But I was told, thank God I was told I am Toto Yuko, and I told to myself, thank God all is not lost. I was so excited because what I was looking forward to niko nayo, but whoever we were working together with to have what we wanted, ndio sasa hayuko. So they came, explained to me what went wrong. It didn't make sense. Like it couldn't have made sense to also to whoever was explaining to me if he and she were in the same position that I was in. I made a call to my mom, breaking the news to her. Then she did to the rest of my siblings and to my mother-in-law. But I thank God that I still have my baby with the little complications that she has, because she has a minor cerebral palsy. I'm trying to manage the situation as it is by myself, because I'm not married yet, 3 years on. It is not easy. If my baby could have been okay, I could have been married by now, because there is nothing to be worried about. But now that my attention has been divided to my baby and her health and her well-being, I have to focus first. Mtoto wangu kwanza nione kama ataweza kutembea kwanza. If she can speak for herself, maybe I can get married to somebody that might not be able to take care of her well, or somebody that might not understand me and my baby, or maybe that could only understand mtoto wake peke yake. I want my baby to speak first, or maybe to be able to walk, so that she can be able to run from any danger or speak of any danger that she goes through. But earlier on, I had taken it upon myself, the first year and the better part of the following year, because my baby is now 3, to take care of my baby myself. I'm a businessman. I sell shoes somewhere in Nairobi and in Kisumu. But I've taken a break from the business to take care of my baby the first 2 years. But with the help of a nanny who came later, and my sisters-in-law, brothers to my sisters, my wives to my brothers, who together with my sisters took it upon themselves to come and help me take care of our baby. It has not been an easy journey the last 3 years, because being with the baby and the condition she's in brings a lot of memories, but are not so good memories to always speak about. I'll always want to be in this forum where I can try and give my story to find and to find solutions to this situation, so that many other men are not in this situation again. But it is not a story that any of you would be happy or to be excited to speak about, especially the situation that surrounded the death. If it was an accident, maybe you can say it was an accident. But in there being that it was an avoidable situation, as much as I don't blame anyone to it, there's a lot we can do. I don't want to ask the medics that are here on anything, or anything that you people don't do right, or anything that we didn't do right. But going forward, from this forum or any other forum that speaks of the same situation, we can actually come up with a solution to such a situation that many other men have gone through. Yes. And I believe there is a solution from our political class, because these are majorly our policy makers. As much as I said, I don't blame anyone. And from medical practitioners who sometimes are not keen, from the stories that we had, are not keen. Probably they don't know the next move that can be that can occur in such situations when our mothers go to bring lives to this world. But in that same breath, I want to salute you because if you compare the cases that you people bring, if you compare the situation that you people work to bring people to life and to help mothers bring people to life, vis-a-vis the situation or the misfortune that some of us have gone through, you people have done a lot, and that is the same reason why those of us that are still alive compared to those that die during that period, or when some of us are brought to life or are being born, are many. I've spoken to many of us because my story has been all over in the media. I've been to mainstream medias and to radio stations speaking of the same and trying to find solution to the situation that we people have gone through. I've met several other people like me that have not been able to find platforms like this to speak of their situations and the challenges these people are facing. But I'm here to speak on their behalf and ask those of us that can make a difference, or those of us that are directly in charge or are able to make a difference so that we reduce, because stopping is a huge task, I believe, reduce these maternal deaths are here, and that you are going to make a difference, and that you are going to make everything good so that some of us cannot be standing here again to explain ourselves or to give our stories, and that the next time you're going to stand here, you're going to give success stories and good stories from your efforts and from the change you people are about to bring. I thank you.
Thank you, Frederick.
We are going to all join in the launch, so you can be upstanding. I hope you'll not hide the cameraman.
Yes.
And the cameraman, are you okay? We'll have a countdown on this screen, so you will help us count down to the launch together.
Just a minute. I think what we've seen is a documentary. We've also done a more detailed casebook. So what we are launching now is the casebook of all the stories, which are accessible. We have some hard copies, but also soft copies in our on our website. So please, this is the casebook that's also detailing many more stories that we've done around the issue, including stillbirths and postpartum bleeding. Thank you.
5, 4, 3, 2, 1,
0.
There you go, telling the story, calling for change. Silent tears, voices of loss. That the tears will no longer be silent. The voices are no longer silenced. Hakuna watu haririri, hata watu walikula mandazi. Thank you, Were. Thank you, everyone else, for telling our stories. Thank you. The stories that will call for change.
Good afternoon. How are you feeling? I'll tell you personally, anytime I listen to a mother or I go to the communities and the like, I go home feeling, did I have to go? Because the stories really move me. It is my first time I've watched the documentary from start to end, because it's been a painful journey. We should have screened this documentary like 3 months ago, but it was the pain of imagining that I have to rewatch this again and just hear the stories. I don't even think I can go to that wall and read those stories, because those are people I know at personal level, and because I've interacted with them. Actually, you can steal the points, because these panelists are not going to answer anything different. They are going to answer the same questions. Why are we here? What is not happening? Why are we not? Jane, you work at Mpisha Hospital. There's the chief nursing officer, and I know you're really big on quality. What do you think is the problem? So I would want you to really just think through, and I don't want us to disconnect ourselves from the stories, because for me, the stories move me to think differently, and they have moved me. Actually, the stories are the reason why I started White Ribbon Alliance Kenya. And for you here, as you watch the stories, as you listen to the real story from what really happened, what comes to mind? Why are we still failing women and newborns? So, Jane, if you can start us off.
Thank you. And I think I really agree with Angela. We have a big problem, and it's important that we rethink our care for our maternals, our mothers, our children, because really from the stories we've seen today, and from the stories which are still unheard, there is a big problem. And it's high time we listen to our mothers. It's high time we stand up and make sure we are able to make sure from the hospital level, the healthcare level, how do we ensure that we are able to deliver quality care, that which the patient requires? You know, these mothers have come to us, speaking from the healthcare sector. These mothers have come to us, these families have come to us. This is because they believe in us, and they trust that they are going to get the best from us. So the call for action for us from where we sit in the healthcare sector, can we put measures in place to make sure we don't disappoint these families when they come to us? Can we do the much we can to make sure once they come to us, we are able to give them the very best? Of course, from the community level, there's also quite a bit which we need to do. And I know one of the things we'll, of course, discuss here, but I know most importantly, how do we keep our communities, our families empowered? How do we educate them? How do we tell them what help is available? How do they seek that help? When do they rush to the hospital? How do they know there's a problem? So that's the angle we are looking at, so that we can support right from the community level and even at the healthcare sector level. Thank you.
Thank you, Jane. What I hear from you is that the healthcare system needs to stand up and do what it's supposed to do. I am not sure whether you are the right person to ask now that you are coming from the private sector, because we know what is offered in the private sector is different from what is offered in the public sector. But why yet we pay so much tax? That is the question. And what are we doing to demand that whatever is offered in the private sector is actually what mothers get in the public sector? Because do we have mothers, if I'm to translate my mother tongue, who are born from the front and others born from behind? I don't know how to translate that best, but those who come from where I come from understand what I mean. And then I also hear the aspect around respectful care, but also the element of self-care, making communities understand their rights, but also the agency to know where to go, but also what to ask for and what to demand for, their rights and entitlements. And I think that speaks to me, because that is exactly what we do at White Ribbon Alliance. Now, Kenneth, I know you're about to leave, and I know I'm stealing your time, but you've been preaching the aspect about maternal death surveillance and reviews. What is really the problem? Why is MPDSR an issue in this country? Yet we know that with the data and with that review, we can be able to know where are the gaps, where are the issues, what needs to be done. Why is it not happening, and what can you propose? What do you suggest? Because I think this alone can be actually a session. Whatever the stories we are listening here could have been a session. 5 sessions from those 5 documentaries. What do you think is the problem, and what can we do? It's about solutions. We are finding the solutions. We are calling for change. What do we need to do?
Thank you, Angela. And good morning or afternoon. Afternoon, everyone. That's a very good question. And I like what was shared this morning. And I think the one thing that comes to mind is that we need to draw a line and basically say that whatever has happened needs to be the last in terms of the women that are dying needlessly as a result of childbirth. And we need to then have actions. Now, Angela, you asked about MPDSR. Now, this is work that we've been conducting for many years in Kenya, in Nigeria, to the extent that we developed an MPDSR tracker that was adopted by the WHO, which we are very proud of. And that was work done in Bungoma. I know Bungoma is well represented in the House. So what does MPDSR do? It really looks back at what actually happened, right? From the point of the woman actually showing up in hospital, thinking about what was actually done, which attendant was with her, and really tracking back where did it all go wrong. And this is not a blame game, because I know historically, the whole MPDSR piece has been looked at as a blame game. And so you find that healthcare workers would rather not either highlight an issue, which is a wrong thing to do, right? It gives you a picture to look back and say, where did we go wrong? Where is our system failing? Is it an issue of financing? Is it an issue of process flows? Is it an issue of even the patient themselves in terms of, were there things that they didn't necessarily declare through that particular process? And so it's a really important tool to reflect. Now you're asking, why is it not, why is it not having the impact that it should? Statistics say that about 90% of counties in Kenya are already deploying MPDSR, right? And so you'd ask yourself, 90%, so why are women still dying? If you ask me, it's a question of MPDSR becoming an administrative tool, whereby we record, right? And we're very happy to say, and I think that's really important, but we cannot avoid the fact that in our broader health system, there are many things that we are struggling with, both in terms of infrastructure. We're not lacking of training. I think there are so many trainings, as much as, today I'm sure all hotels are full with some training of some kind. So we've been trained out. But the question is, how are we translating that knowledge into action in the facilities? But then most importantly, and I'll put this out there, is who's accountable? Are we taking that seriously? In my introduction this morning when I came a bit late, I was asked what would be my superpower. And I said, if my superpower would be that every healthcare professional, everyone really has in their mind, reminded every single morning of that person who passed on. So that you have an impetus, there's something driving you to actually take that personal responsibility towards ensuring that someone's life is not lost needlessly. And remember, we're talking about preventable deaths, right? So for me, I need to just point that out, that yes, childbirth, as you know, I'm a Christian and I know, thanks to Adam and Eve, women have to go through what they have to go through, right? But it happens, right? And deaths do happen, but we should avoid the ones that are preventable. What can we do to prevent?
Thank you, Kenneth. I think what I hear from you is that MPDSR should be made an administrative tool. There is an element of response, and I think with response comes accountability. That's what I hear from you. And a lot of times it's about ticking the box, and I think that's what is being done in many of the 90% of counties that are really doing this. You tick the box, we have this going on, but what is the response? What do you learn from it? That's what I'm hearing from you. And the element of accountability, responding, and ensuring that we are not fighting. It's not a tool to blame, but a tool to really change and respond to offer quality. But there's also the element of governance, and that comes with accountability. And then the powerful question is, who is listening? Are we listening to respond, or are we listening to act? And those are very different things. Are we listening so that we can respond with preformed answers that we are doing this? Or are we listening to take time to understand where the gaps are and act? Thank you so much. And at this moment, I would release you because I know you're supposed to be heading somewhere. But before I release you, or actually I can release you, someone else could answer that. I want to come to Dr. Steve Wantei. You've heard a lot of things. One of the things, the many things that I've heard across as I listen to the first stories is that multisectoral action is needed. But every time you go to the groups, you find the ministries of health are sitting alone. The road network people are sitting alone. Water is an issue. Women told us in our original What Women Want campaign that we want clean water. We are tired of dirty toilets. Women with disabilities told us that we want disability-friendly toilets. We want ramps in our health facilities. We've heard from Yamat that the road was really terrible. We have heard from Rioba that she was not told anything. Health literacy is a problem. How are we integrating all these sectors at county level to ensure that we are responding to the needs of women and girls? Because it will not take, I keep saying that health is not a health sector issue. It is multifaceted. It's 9 months. Can you imagine those 9 months and the 9 things? Agriculture is an issue. Security is an issue. Climate action is an issue. What are we doing and how can we do it better? Or what are we not doing? Thank you.
Thank you. Thank you very much, Angela. And good afternoon, all. Today, it's really mixed feelings. Because when you talk about mortalities, it's a heavy discussion. But again, we want to listen and act. And therefore, there's an excitement that we can learn from the previous unfortunate experiences so that we prevent any other future mortalities. One of the best things that happened in this country was devolution, because it brought the services literally closer to Mwananchi. And the issue of multisectoral engagement now is much more robust in the devolved units, including the maternal and neonatal space. Within our experience, for example, in Kakamega County, there's a lot of community engagement, right? From the households, through our CHP structures, and within the community, we engage everyone who is there. Within the sub-county and county levels, we have technical working groups, and again, they bring in participation from the health department, from the governmental, non-governmental entities into the technical working teams. At the county level, we also have the technical working teams, but we also have a very robust engagement with the assembly, the county assembly. And I know across the country, in all our counties, we have health committees within the assembly. And these are strong areas that we use to engage, especially when we want the multisectoral engagement. And the example you gave about the lady who had to travel 25 kilometers on raft ride, already that's the Department of Roads from where you sit. But there's still the Department of Health, because according to the WHO targets, we are hoping that there's a facility within less than 5 kilometers of our households. So that's still around the health department issue. It's about transport, it's about security, it's about health, it's about education. And therefore, those are areas that we can strengthen on. One, can we strengthen community engagement so that we talk about maternal issues? In our team, one of the issues that came up was the low awareness levels even amongst especially first-time mothers and their spouses. They don't even know the danger signs in pregnancy. They take so long to probably start seeking advice. And there's a lady who shared that healthcare workers are also part of the challenge, because by nature, healthcare workers are very quiet people. Even in this setup, those who are very quiet are most likely healthcare workers. Except Angela. The challenge with that is that, and she brought up very well, that we never open up to our mothers. So, like her experience as a first-time mother, she doesn't know what to ask. She doesn't know how to start that discussion. And as a healthcare worker, we are quiet with it. Until it's too late, they're probably bleeding, they have elevated pressures and so on. So healthcare workers must be part of this engagement at all levels, at all times. And I mentioned the school health program. We need to strengthen that so that we talk to our boys, our girls at an early stage, even before they are at the stage of probably getting expectant. We need to strengthen advocacy, Angela, at especially the county level, so that we bring all these players on board, so that even the honorable members of the county assembly appreciate the linkage between a bad road and bad health outcomes. They appreciate the linkage between security, right, and bad health outcomes, right? Incidentally, most of the time, labor pains strike at night, right? Even if the facility is 5 kilometers away, are you going to walk the 5 kilometers to the facility? So security becomes in as a strong issue. The issue of budgeting, because eventually healthcare financing is at the core of everything. Are we budgeting adequately? Are we lobbying well with the finance team, with Treasury, so that they allocate more resources towards health and more specifically towards maternal and child health? I know my coordinator is here, and part of the challenge as a county we've experienced in the past few months is that in most of our, especially lower level facilities, we are not even able to do NC profile during the NC clinics. And that means that we miss a lot until the mother now comes in labor. So
let me just hold you right there. What is the problem then? Because I feel like who doesn't pay tax at the end of the month? We all do these things, but where is the problem? I really want to understand. Why are you not doing NC profile? Honestly, what is the gap? Where is the issue? So it's the issue that there's no money? It's the issue that there's no will? What is the issue? Because I feel I've been in panels where all these things that everyone is saying are being discussed, Steve. But what is the problem? Because once we find the problem, or do we just become a pathetic give up and say, okay, let's do it? But no, I don't think I'll be able to sleep at night. So where is the problem?
We can't give up, Angela. And that's why your question of multi-sector engagement is very key. We need, as healthcare workers, we need to learn to advocate more so that people see the linkage, like I said, between poor roads and bad health. We are not doing that very well. The linkage between insecurity and poor health. We are not doing that very well. The linkage between low budgetary allocations and poor outcomes. We are not doing that very well, right? The linkage between, say, lack of drugs, because like within the counties, if there are no drugs in the facilities, people will rarely blame Treasury. They will blame the director, and Dr. Wata is here. Yet his hands are totally tied. So we need, as players in that space, and I'm really happy that even White Ribbon is coming, pull us together with the other stakeholders, strengthen advocacy, help us engage with the MCS so that they see this linkage between the contribution of the other sectors and positive health outcomes.
Thank you so much. I know I put you much on the spot. And I think you've spoken to something that is really powerful. And it's an approach that we have adopted also, that the people, the users of care, the practice and the policy is speaking the same language. And I'm hoping that we can be able to showcase these stories in such forums, in those county assemblies, in those places where people can actually see where the linkage is, because those stories speak for themselves. The issues speak to themselves, for themselves and the like. And I know a lot of times the blame is pointed to the health ministries. But when I speak to the healthcare workers, when someone tells you, we know we have nothing, all we need, I had this in Kisumu 2 weeks ago. We have to play music for the mothers, because we don't even have painkillers to be able to give them. So we play some good music from their phones. They are taking an initiative and congress with the midwives of Kisumu so that mothers can feel better, because the pain is too much and sometimes they don't even have what to give them. Or they are keeping them busy as they are waiting for the next mother to leave the delivery bed for them to get another mother. I mean, it should not be happening in this time. Thank you so much, Steve, and thank you for sharing. I think what I hear more is also around how do we advocate as one? Communities, mothers, users advocating with healthcare workers. For the longest time, everybody has been accusing the other person. And I think when we did the What Women Want campaign, the initial thing we had that healthcare workers are not listening to us. We went to the healthcare workers, and I think you'll see one of the reports, the Midwives' Voices, Midwives' Demands. They told us that we want to listen to you, but we don't have what it takes. Please also speak for us. So they are really speaking, can we do different? Can we work together? And what we've been doing at White Ribbon is bringing everybody together to really speak, including the policymakers. And I'm glad we have you guys here, because we have forums where we have had forums for accountability, everyone speaking and saying, this is the action I'm going to take to ensure that we move together. Now, Dr. Kireki, you heard the Kenya Obstetrics and Gynecology Society. You've heard how many times doctors have been blamed in these stories. Please tell us, where is the problem? What is happening? Yes, Dr. Kireki, the chief was calling. Did the chief promise that we have more doctors coming in? What is the problem? Please tell us what is happening and what do we need to do?
Actually, that was a call from theater. It was a lady with placenta previa, and it is fine. she will not be a statistic. Thank God for that.
Thank God you picked your call, because the doctors in the stories were not picking their calls.
I had to. Thank you very much, Angela, for inviting us. We rarely get invited, but we will keep on inviting ourselves. We don't invite us to Takuja too. I think this is a fantastic forum because we are sharing, we are listening what people are saying, we are listening to what patients have gone through, and we are actually looking at it from the other side. What Fred here was talking about is something which is heartbreaking. The other stories that we saw, Rioba and others, I mean, it is not okay. It is not right. But I want to look at it from a slightly different view. I think it was in October or November last year. I had finished a procedure I was doing in one of the private hospitals. And then as I was going to change from theater scrubs, one of my colleagues, a senior anesthetist, comes running and says, "We have a bad PPH. Come to theater 3, theater 4. Come and see what is happening." So PPH, as we know, and some of these cases that we have watched, it's an emergency. So I ran to that theater. I find my colleague struggling with this lady. So I asked her what happened. He said, "This is a first-time lady. Delivering for the first time, 31 years old. She had delivered a baby girl and there was no problem. But then soon after delivery, she just started pouring. There were no tears, nothing. So there is a checklist you go through as a consultant. Have you done 1, 2, 3? Said, yeah, I have checked. There are no tears. I've done this, but she's still pouring. Imagine for those ones of us who do surgery, you took an abdominal pack and insert it in the vagina, and after 2 minutes, it's completely soaked. So you get it out and put in another. So she was actually draining her life out. So I said, okay, let me have a look, fresh eyes maybe. So I look at the cervix is okay. The vagina, small tear, which one suture had been placed. The uterus is contracted, but a few clots are coming out. But this does not explain why she's actually pouring. So you ask the anesthetist, have you given medications? Yes. Which ones have you given? 1, 2, 3? Yes, I've given all of them. But she's still pouring. So I said, okay, let me insert my hand inside the vagina and try and see whether there's a problem there. So when I inserted my hand, I could feel as if at the back of the womb, there was a structure there. Most probably a fibroid. So my theory was that the placenta was lying on top of the fibroid. So when the placenta came out, the vessels did not do what? Did not constrict, and she was pouring from there. So we put in another abdominal pack. After 2 minutes, it's soaked. And then you can hear the anesthesia machine, going tick, tick, tick. And those ones of us who work in theater, you know what that means. So a cold sweat starts running behind you because you're actually losing this woman, a young woman. So I said, okay, we have done this, in my mind, you're going through all this. Then I say, okay, do we have a UBT, uterine balloon tamponade? It is not there. There is no UBT which we can actually insert so that she stops bleeding. So the next thing I ask, give me a catheter. So we get a catheter, but a catheter does not help you a lot. So I ask, do we have a condom? Everybody went quiet in theater. I asked, do we have a condom? There is no condom in theater. And then one of the ladies walked out, one of the nurses. She walked out, she said, let me go and look for it. So when she came back, the first thing she said, I want to say, it was not in my... It was not in my handbag. We said it doesn't matter whether it was in your handbag or whatever. Let her your condom. So we fashioned a UBT. The normal way, we just inserted it on the catheter, inserted it into the vagina, into the womb, pumped in 200, 300 mils of water, of normal saline, and guess what? It stopped bleeding. You cannot imagine the relief that all of us felt. I can see Dr. Watau is here. We know what we go through. Anyway, so we decided to pack the vagina with an abdominal pack as well, just in case. So the lady went to ICU. It was on a Friday. She went to ICU. On Monday, she went home. She was not my patient. It was my colleague's patient. So when we met, when my colleague called me, she's told me, the lady is fine. Remember, her HB when she delivered was 11.3. When she went to ICU, her HB was 3.1. So she was actually dying. Na tunaangalia. So what actually saved her? Coming to your question. That was a private hospital. Number one, there was human resource. There were 2 consultants, actually 3. We were obstetricians, and there was an anesthesiologist on the other side, very experienced. So human resource. Number 2, there were medications, quality medications. If you look at one of the studies which was done recently, it was discovered that some of the medications that we use in Kenya is actually fake medication. Emotive says it's fake medication. What does that mean? It means that the oxytocin, when instead of saying 10 international units, you may have 3 international units. So when you give the patient and they expect the uterus to contract, it is not contracting. Mpatie ingine tena 10, it's not contracting. Tena ingine 10, it's not contracting. So you wonder, what is happening? Is it me who's doing the wrong thing? No, it is the medication, the quality of the medication. Number 3, we had blood. In Kenya, we collect 276,000 units of blood in a year, and that is barely 60% of what we need. We need more than 500,000 units in a year. And guess what? 70% of what we collect is actually used by who? By women who deliver. So if you don't have enough blood, there is no enough blood to give to the women, so they will die. So we had blood. Number 4, we had an ICU unit. Daktari here on our table here we are talking about, he said, but people, in counties, we are building and building and building and building structures. So you may have a structure which is written ICU, but in that structure there is nothing. Or you may have a structure written ICU, there is 1 or 2 monitors, and then there is nothing else. Or you may have a structure and there is equipment, but there is no what? There is no personnel who are qualified enough to run that. So there are actually 4 or 5 pillars. Number 1, the human resource that I mentioned. Number 2, the medications, quality medications. Number 3, blood. Number 4, we have ICU. And then we also have what? People who are qualified to actually take care of these patients. Now, any of these pillars, lack any of these pillars, and the women will die. It doesn't matter. If you lack blood, you have equipment, you have human resource, doesn't work. If you have human resource, you have medications, and you have blood, they will die. So all these pillars must be there. And that is the problem we have. Government, you are here, Daktari. That is the problem that we have. So infrastructure, yes, it will come. You can have a beautiful infrastructure, and any of these pillars is not there. We saved that baby, that lady, because in that hospital, there were all these pillars were available. Do we have all those pillars available in our public hospitals? No. In KNH, sometimes you have a patient who comes with a HB of 2, 2.9, 2.4, and you say, I need 10 units. Unaambiwa you can get 1. What are you going to do? That is where the problem is. So it's not blaming doctors or blaming, healthcare workers. It is all these pillars. And I think it's good the authorities are here, such that we try and enhance. And I'm very glad my dear friend MP is here, Wamushomba. Amepiga kelele, na tunataka uendelee kupiga kelele kabisa. So that the powers that be hear that our women are dying, and they don't have to die. Absolutely don't have to die. Thank you.
Thank you. Thank you, Dr. Kireki. I think you've said very powerful things. And what you said is actually what women have told us. When we asked women, and we keep asking and listening to women, what does quality reproductive health care mean to you? the first thing they told us is respect and dignity. And what does that mean? If you respect me, you give me what is quality, you are on time, you have enough health workers, it's encompassing everything that you said. They talked about water sanitation and hygiene, which again is another element of quality and dignity. Talking about life-saving medication. It's so sad that we are talking about fake medicines. I keep asking in this country, does it mean that poor people should get poor quality? Or people who cannot afford to get to those private institutions have to die? Why is it written? Yet health is a right. We can't disconnect that. Blood, honestly, we keep on going for blood drives. Where does the blood go? And why are we not having enough blood? ICU. And it's so sad that we are a ribbon-cutting country. We love cutting ribbons. That's why we love structures. And we love the cameras because we want to say we launched a bridge. I watched this clip in this bridge in Congo. Someone launched and the bridge fell with the person who was launching the bridge because it was poor quality bridge. I was so happy. But I was so happy that it fell. Because we are launching fake things for the sake of being seen. And Honorable Wamushomba, you are here. You know that your group of people are I'm not saying you, but a lot of your people love that very much. We just like the cameras, or they did this and then we post photos. Even us in the development sector, we want to do things, take photos, post there, I was with the minister. So what? For me, the question is, so what? You can, and that is why I do not like some of those things. Oh, big things, oh, we did this, and then what? You will tell us on your social media. But then how will you have transformed? And I know I can be very provocative, and I'm asking the same question to all of you. Whatever you are doing, how is it translating? What is in the last mile of what you're doing? Thank you so much, Dr. Kireki. Even as you do that, I know you had COGS. These stories need to get to every doctor. Because I'm sure there are doctors also who don't pick calls, even to explain to that mother that actually I am committed. What women told us is, I want to be listened to. I want information so that we can be part and parcel of the change that you want. We have to work as a package. The master-slave syndrome has to end, because that is what is happening in this country. And it is both in the private sector and in the public sector. Now, Eve, you've been our champion for the longest. You've lived with the women. Some of these two women came from your villages. What do we need to do? Why are we not changing? Surely Kajiado is just here. Why are we having issues with roads? Why are women not even having the knowledge? Kajiado is one of the counties where 90% of the women are illiterate. Why are women not getting the right education? And what do we need to do? Thank you.
Thank you so much, Angie. And good afternoon, everyone. Thank you also, Mheshimiwa Mushomba, for coming to be with us. Whenever we see you in Parliament, we see a voice of reason. You give us even the reason to watch the discussion in the National Assembly. So thank you so much. Thank you for that question. First and foremost, this is really a moment that we don't want to go through it again. But there is a lot that is happening down there in the villages, and there is a lot that we need to do as a team. Thank you, Daktari, for saying that the approach that we need to take is multi-sectoral, multi-agency, multi-government, multi-partnership. Because the needs down there are just enormous. No one can address to accomplishment. In our villages down there, I can give Kajiado County as a very good example, because that's where I live, that's where I work, and I've lived with those women for the longest time. In Kajiado County, 90% of the women in the rural areas are illiterate. They have never seen a door of a classroom. They do not understand their own body system. They do not understand government processes. So you can imagine, even when we are talking about maternal deaths, then they are still struggling with other issues that are very basic. information is one of the things that women need. Timely, accurate information. I saw one lady, I think from Kisumu, who have been having a problem with Renaissance factor. Thanks to God, that lady is even semi-illiterate. Think of an educated woman, someone illiterate. When will she ever interact with that word, Renaissance, negative, and understand? She will lose all her babies, and nobody will be there to explain to her that there is something wrong, that there is something wrong in her blood. So what the women need is information. Women need information even before getting to marriage. You need to understand your own body. Even before conceiving a baby, you need to understand your own body. Who will help us to understand our own body? It is the medics. That when I go to a clinic, I need a little training about my body. What do I expect? Because not every woman understands. So one thing that women need is information. Number 2, they need access to these health facilities. Yamat Pilingon walks 25 kilometers to get to the nearest clinic. Not even a referral hospital. That's just a dispensary where you can only get Panadol, painkillers. She will have to walk 25 kilometers. If all the women are facing the same, then we are out to lose many women as possible. Kwa sababu wakati mtoto anatoka hakupigi ripoti kwamba nitatoka saa 3 ya usiku. Na atatoka tu ile saa alikuwa amepanga atoke. So we need access to health facilities, well equipped, as Daktari says, with all qualified personnel to attend the women. So as we go to these devolved units of county governments, we should not put all the money into infrastructure, and we forget that we also need the personnel to attend to these women. Women need also space to talk about their issues. They need to be heard. In our counties, when women go for meetings, they are never given an opportunity to talk, because in our community, women are as good as children. It is the men to talk, and I wonder if they do understand the needs of women in terms of reproduction. They don't. They don't know that you need a clinic, you need a doctor, you need this. But they're the ones to talk. So women need to be empowered in such a way that they can come out strongly and demand for services that will support their well-being as women. Because people will go to a meeting, they'll talk about classrooms, they'll talk about the bridge, they'll talk about the water project, the livestock project that we need to put up in our village, and yet there is no hospital, which is so paramount to the well-being of the family and even the society at large. Thank you, so that I don't take so much time.
Thank you so much. Let's clap for them. I think I've heard a lot of things, and one of the things I've heard is health information. And that starts with, they say information is power. But will you seek information if you don't see the value of information? So we have to ensure that the women also have the education. And not just education, the health education alone. I think for me, even just the basic education to understand things, to be able to read and write. We work in Kajiado County, and it's one of the most, I don't know the right language you say in I have to think in my mother tongue. It's very diverse, but also very, you have to traverse very different things, mountains. Yes. Sorry? Oh, expansive. Oh, thank you so much, my schoolmate. Expansive and all these things. And women in different places, from Loitoktok to Rombo, which is almost like in Tanzania, to Kajiado to Gong. So when people talk about Kajiado, a lot of times we go for the easy to reach, like most of them. Yes. Kitengela, Ngong, Matasia, and all this. But there are women all the way under Mount Kilimanjaro and all that. I think I've heard about access to health facilities, but access is really different. Access is not just a physical access. There's also the social access, the emotional access, the economic access, and so many other forms of access. And I think one of the reports we are launching today is what women want for economic empowerment, because women in Kajiado told us that we can't access health facilities because we don't have the money. And we have to pay for everything, including the cotton wool that one of the ladies said that she was sent in labor to go and buy, but she couldn't, and that's why the baby was asphyxiated and the baby died at birth. I think at the end of the day, we also need to think about personnel, because you can't have health facilities without personnel, as we heard from Dr. Kireki, but also from Steve and Jane. And also the space to have women speak. Not a space just to say they went for the meeting, but how are they engaging? But I think there's something I've heard in the morning. Where are the women living disability? Where are the adolescent mothers? Where are the rural women? Equity in access is also very powerful. A lot of times we program for the easy to reach. But where are the refugee women? Where are the migrant women? Where are these other women who are left out? So I think it's important that as we are discussing this, I'm hoping they're the same things that you spoke about in your groups. How can we make a difference? And I believe all of us can make a difference. We should not just look at them. What are you doing? And one of them is uniting for a cause. This is not a white ribbon issue, by the way. You know, I hear people saying, oh, who does advocacy is white ribbon. We should be everyone's advocate, honestly. We should not just wait is this particular organization. We should be the advocates, because these are issues that are with us. And pregnancy and childbirth is not a disease. It does not have to wait for us to have WhatsApp groups to talk about. Honestly, it should be a time all of us should be involved. So I'm calling on all of you to be part of us, to join the advocacy movement, because advocacy, we have said that maternal newborn health is everyone's business. Thank you so much, ladies and gentlemen.
All protocols observed in the room. Good afternoon. I am so excited to be here, a bit very late, and I register my sincere apologies. I have no very good reason why I am late. I just got confused into the political events of the day. So I'm one Kenyan who is very honest. My name is Gathoni Wamushomba. Juzi tu nimeambiwa niongezewe title ya daktari, lakini sio gynecologist. Lakini ni daktari wa matendo ya community. Mimi ni mjumbe wa Githunguri. I am serving my second term in the National Assembly of Kenya as an elected woman. Na mimi ni chairperson wa kamiti ambayo inafuatilia implementation of the Kenyan Constitution in the National Assembly of Kenya. I am the outgoing KEWOPA chairperson for the last 3.5 years in the National Assembly. And I am a woman leader who is not apologetic of being a woman. I dress like a woman, I walk like a woman, I talk like a woman, and I fight for the women. Angela is my very good friend, and I love her zeal. I love her energy. I love her focus. I met her in the corridors of Matters Women. I met her when she was advocating for the dignity of women in labor, women in the delivery room, women who are carrying gifts called babies. And I just loved her energy. And when she whispered to me about a week ago or 4 days ago that she has this forum, I promised to come, though I had already planned my week. So I had to negotiate my way out. And therefore I have a forum in the afternoon which I cannot change. So that is why I've insisted that I need to say hi. So can I say hi? Yeah. Hi. Now, it is true, I've heard some of you mention, like my friend Dr. Kireki, who I also met along the corridors of fighting for women's dignity during labor and during delivery. I have met so many other doctors like Dr. Kireki. I have met the president of the World Federation of Obstetricians and Gynecologists, Dr. Anne Kihara, who is a very wonderful lady. I have met the chairpersons and the people who manage the nurses of this country. I have met the COG chair and CEO on matters obstetric violence. I have been advocating against violence against women in labor. Ile maneno ya kwenda kwa ward, kwa delivery ward, unalimwa, unapigwa makofi, unaambiwa push the baby, unagongwa, na huku nyuma, sitaki kusema hiyo jina, hii nyuma, nyama ya huku nyuma, si mnaijua? People have normalized violence against women in labor like it's a normal way. In fact, when women are sharing stories, how they delivered, they normally say how they were shouted at, how they were abused, how they were indignified. And women in the village, and I'm very glad I've had my sister, I didn't get your name, but I love your Maasai outfit. I was following you when you said the life in the village, how women have normalized to go through the pains and the loss of baby deliveries. You also mentioned something and said, women don't have information. They don't know to what extent are their rights enshrined. To what extent can the woman's right during delivery can be protected. And it has become a blame game. When a woman goes through violence during labor, when her rights are violated, they all say it is that doctor, it is that nurse. But the women themselves also don't know their rights. They don't know what is it that they are supposed to do and what is it that they are not supposed to do. And so many women are suffering in silence. So many women are in pain, in anguish. Let me tell you the kind of information I get every day on my inboxes, my social media platform. Women even who visit me physically, because I decided to be very vocal on matters of obstetric violence. Now, why did I start this work? I started this work because I'm a victim. And I'm a victim who didn't know. Like I'm saying, most women don't know. You don't know whether what you're going through is the normal way of getting that child. So I suffered. I later on realized that I suffered. I did not just suffer physically, but I suffered emotionally. I am a rhesus negative mother, and I didn't know that I was rhesus negative. Imagine, and I'm learned. Imagine, and I've gone to school, and I didn't know. And even the people who handled me did not disclose to me until that very moment when the baby was pushing out. So I was wondering, where is everybody running in the delivery ward coming to my bed, and they're not going to other women? The other women are screaming and the babies are coming out. And I can't see these very many nurses and doctors on their beds. Why are they crowded on my bed? I didn't know. Until when it was too late. Now I'm a mother of 1, and I had loved to be a mother of 10. But I could not get any other after that, because the people who handled me did not disclose to me what I was supposed to have done and what I was supposed to have gone through. I am a proud mother of 1, and I now later on realized that even in my family line, my father's side, they also went through the same problem, because I didn't find my granny, the one I'm named after, because she died during baby delivery. My first cousin, who is named after, like me, died when she was delivering her second baby. My other cousin, who is also named after me from my father's line, also died during baby delivery. So I thank God I'm alive. Please clap for God for saving my life. So how many women are going through what I went through and are not even aware? Do we have to lose them like we lost my 2 cousins? And it's not just about being less as negative. There are so many things like Dr. Kireki has talked about here. The extreme bleeding issues. you know, the stitches that sometimes rupture. You know, there's so much that goes through women during delivery that we must shout out. Now, listen to me. I shouldn't be standing here to talk to you as a Mheshimiwa, because I honestly feel very ashamed as a Mheshimiwa standing here to join you to complain about problems. Please clap for me for realizing that. I shouldn't be in this room to come and complain with you. I should actually be here coming to provide you solutions. But I'm very ashamed to be a politician in this country, because politicians in this country are actually not the solution to problems. They are the reason why the problems are there. Please clap for me if I'm talking the truth. Because why should we have somebody elected as a 2-term governors, and in that county, there are still women dying because they cannot access maternity care? Why should you be elected for a second time? Honestly. Yesterday, I was talking to one of my fans, my followers, who is in a different constituency from where I'm voted. But they believe in me, so they call me and tell me their problems. And he told me, you know what? I'm sorry. He actually apologized first. I'm sorry for telling you matters women. But please, even if I'm a young man, allow me to tell you matters maternity. And then I said, okay, what's the problem? He told me, you know what? I am planning maandamanos in my village because our governor shut down the only maternity facility we had in our neighborhood. And he told women if they want to deliver, they must go to Kiambu District Hospital, because the hospital that was providing maternity services is closed down for maternity services. You can only go there for insulin, diabetes, hypertensive, and that's it. He also closed it such that you cannot access medical care after 6 p.m. Reason being, he has no sufficient staff to attend to that village. So we have misplaced our priorities. Governors are running up and down to come up with buildings, to come up with structures called hospitals. But inside those structures, there's nothing happening. Am I talking for you? Yes. Am I talking the truth? Yes. You know why? It's because when the governor or the politician like Wamushomba does a structure called a hospital, there is a contractor involved, there is money involved, and there is kickbacks involved. But when it comes to recruiting nurses, recruiting healthcare providers and technicians, there are no kickbacks. So they would rather run to come up with structures and cements and concrete in place so that they can get something out of it. I mean, time has come for you guys to change this country. You must take the space and change this country. I said I shouldn't be in this room to come and complain with you. But as we sit, how many people think about violence around women during delivery, during labor? Listen to my story. I'm sorry to tell you this. When I realized that there's a gap on matters obstetric issues, you know, delivery, maternity care, and especially on the advocacy part of it, information dissemination part of it, and remedies, I decided to present a motion in Parliament. Angela is my witness. And I actually did a very big launch, and I called all those politicians you want to come here and listen to your problems. I called them. And I called the minister in charge of health, then was CS Susan Nakumicha. I called the gender human rights advisor, Dr. Kireki, you were there, you remember? And we launched a campaign to start making a national policy on matters obstetric violence. And I crafted a policy, and I crafted a motion. I presented the policy draft to the minister. And the person who advises the president on matters human rights, Her Excellency Harriet Chigai, the president's sole advisor on matters women, was in the room. She was actually the chief guest. The secretary to the cabinet, the lady who advises the president on the agendas of any cabinet meeting, and she is the secretary who takes notes, was in the room. Madam Mercy Wanjau. And we launched and we said, you know, it's a new dawn for Kenya. Let us come up with a national policy and also come up with a legal framework, a law that can guide us on how we are going to handle matters of obstetric violence. My motion, I presented it on the 9th of December last year. To date, my motion has never been debated. Why? Because finance bill is more important than my motion. Because affordable housing is more important than matters women. Because many other things are more important than women issues. And so every time we go for recess, I call the clerk and I ask, how far is my motion? Then I'm told, I'm sorry, we have this emergency that we have to sort out, and then your motion is going to be scheduled. And that has been the song. For those who understand the legislation processes of Parliament, when you present a motion and it takes 6 months before it is debated, the motion lapses. So my motion has lapsed. I can only now get another member, not myself, to present that motion on my behalf. And you know what? It is not by coincidence. It is intentional. So that that whole process of you bringing new laws that are going to ask this government to invest more on women can be stopped. You people listen to me in the room. You must change this country. If you don't want to change this country, stop doing these meetings. Stop coming here. Because you sitting here, talking and talking, may not give you any help, any remedy. Parliament is one of the avenues where we can get solutions. For example, let me ask you, has any one of you looked at the latest budget, the national budget, the one that was made by Parliament? And after you've dropped, and I dropped finance bill, we revisited that budget. Have you taken time to check how much money was slashed off from the Department of Reproductive Health, Ministry of Health of Kenya? Have you taken time? Do you know how much money was slashed off? If I told you, I would depress you. We need serious advocates, people who can fight for the women of this country, for the reproductive health of this country. Because if we get it wrong during reproduction, we can never get it right anywhere else. I mean, if we get it wrong during reproduction, PWD's people are going to be more in this country. Can we afford? So, if we get it wrong in this country, we are going to have so much mess, because reproductive health is the pinnacle of any population. Am I right? Yes. So we must actually support Angela and many like Angelas in this country who are actually advocating for reproductive health. Now, I've already spoken to one women representative who was a nurse before she became a member of Parliament, and she has agreed to adopt my motion and present it again afresh. But the problem is not the person to present the motion. The problem is the majority leader. Is majority leader and the speaker convinced that my motion is so important to be given priority? Can you answer me? You don't know. Is there any goodwill from the political class to invest in matters reproductive health? If a governor will abandon a functional clinic, but he can invest in a nursery school next door, what is the nursery school for if the women are not giving birth? What is it for? So I'm just using an example of my governor. I know this is happening across the country. And ladies and gentlemen, I'm sorry to sell you negativity. I'm sorry to tell you the truth, but that's the truth. The truth is, I thought the day we will have a female cabinet secretary for health, matters reproductive health would be the flagship of every debate. I thought the day we will have a female permanent secretary of health, matters reproductive health will be the flagship debate of this country. I am one member who is very disappointed that we got 2 years of leadership by women at the helm of Ministry of Health, and I never saw any milestone on matters reproductive health. I hope the new lady who has been put in place will protect the image and cover the loopholes. How I pray that one day, in line with Isaiah 20 verses 60, that when the Lord will decide, he will do it. I hope that one day the Lord is going to give me an opportunity to make a difference in this country. And I so believe if you want a country to flourish, invest in women. Invest in reproductive health. I'm not trying to say that the men are not important, but of course we have the catalysts of the process, the drivers of the process. It is the women. It is my sincere hope that before 2027, we will be able to get a national policy on obstetric violence in Kenya. It is my sincere hope that the stories I am reading, because I've read a few documentaries that have been printed, the stories I'm hearing, it is my sincere hope that these stories will be no more. And we'll be talking about stories of success, stories of intervention, and stories of redemption. I'm sorry to speak to you when you're hungry. I am also very hungry. I am sorry for being late for this extremely wonderful forum. I promise to be your partner. I promise to talk on your behalf. I got somebody from X who got in touch with me and asked me, what is this that I believe in OBV, the Obstructive Violence Campaign, because every week I must put a post on OBV on X. So they asked me, can you change your title from Honorable Dr. Gathoni Wamushoba to OBV? So that whatever post you put, we know it's coming from OBV. And I told them, if I put OBV, nobody will follow me. And because most people follow me for the name Gathoni, I'll use the name Gathoni, the page Gathoni, to talk about matters that relate to women. Last year, myself and Angela got an opportunity to go outside the country to lobby and talk about matters women. I got a lot of interest. And all our problems and our needs were lumped up together to be presented during the UN Women Commission meeting that happens in Washington, D.C. every year. So the Minister of Gender, the former Minister of Gender, my friend, Honorable Aisha Jumwa, was very excited to take all the issues that the donors wanted us to put together so that she can present them as a country so that we can get support. To my shock, to my very shock, after 6 months of putting together documents and testimonies and all what we needed to do so that we can present the case, a Kenyan case, to the world, when we went for that conference, the minister herself failed to wake up in the morning to go and do the presentation. She didn't wake up. So the platform that was given to Kenya, we sent a very junior presenter to come and present, somebody who had not even assimilated the document. And there are some presentations you need first of all to understand so that you can go exactly, that's the word, internalize. And I looked at her presenting and I was like, oh, Kenya, you are a joke. Oh, Kenya, you are a joke. So I realized this is a game. We are playing a game. We are not interested. We are not bothered. Now, if the government is not bothered, the civil society should take over. Now, you people here, representing different organizations, please take over this matter. Be aggressive. Fight us on social media. Attack us. I like the way you guys attacked us when, Kabua, when we refused to join you on end feminism. You remember the walk that was in town? Politicians disappeared from the walk. I like the way you bashed us. You bashed us until now. If you call tomorrow, we all be out. Can you bash us on matters reproductive health? Can you bash us on matters women health? Can you continue bashing us? Go to my inbox and bash me there so that even my colleagues can see that you're bashing me. Don't say Gathoni is nice. I cannot be nice and I'm not doing anything. Even if I'm nice and I'm alone, Parliament, you require quorum. Even if I'm alone, talking alone, it's not going to help. Ranting on X is not going to help. It can only help if you have quorum that can represent issues like Dr. Kireki was talking about here. Let me ask you, take time tonight. Go on that page of Treasury, budget page on Ministry of Health. Please invest time. Go. Check how much money was allocated to women reproductive health. Please go and check. Again, it's money that was allocated to KEMSA for drugs that is coming from outside the country. Go and compare budgets and get to know where politicians' hearts are. I'm sorry to speak to you when you are hungry, because your assimilation level is very low. I promise to join you on the next forum when you're fresh, not tired, not hungry, so that I can also give you an opportunity to tell me what you think I should know so that I can make a difference in this country. Asanteni sana kwa kunisikiliza. I'm sorry for telling you very negative things, but I have promised to you that I will do my best to make sure that the national policy on OBV is in place, and I will fight it out in that parliament to make sure that matters OBV are highlighted and are done. And by the way, before I forget, as you talk about what you're talking, please loop sanitary towels in your discussions all the time. Because I fought alone in that house, and I was branded. I was given very bad names. In fact, there's one man who is a lawyer who asked me, "You think you're the only one who has menstruation?" Because I fought alone, and I told the men in the house to shut up when matters sanitary towels are being discussed and allow the women who are the users of the sanitary towels to speak. It pains me so much, Angela, that we look like we are second-class citizens of this country. That matters sanitary towels are things that we allow the Speaker of the National Assembly, who is a man, to preside on, yet he has 2 women deputies, who he can always say, "I'm sorry on matters sanitary towels, I have my deputy here who can execute the matters better." We have been subdued to that level, where even such matters, the men have taken over. Apologies to the men in the house, but that's the situation. God bless you, God keep you. Asante sana.
Thank you. Thank you for your powerful words. I think for me, the thing is, at least first, I'm not alone. I was with Honorable at CSW in March, and I was very embarrassed when I heard that story of the minister. Yeah. And I think we need just to come together and fight. First, as women, we are the majority. But we also have champions here who are men who want to see the change.
Thank you.
And I think the question to ask ourselves is, where do we go from here? Do we sit back, or do we come and bash Wamushomba and others on the streets, such that we never give them a platform? When they stand, I like the Gen Z revolution, by the way, because when you stand up, we stand up and tell you, no, you haven't done it. How many of us are willing to do that? Because we are afraid to be called names. Some of us are not. So the question is, where do we go from here? Change is inevitable, and the only constant in our lives is change. Will you listen and act? And thank you for committing to take that forward, and thank you for coming. So I want to send a message to you and the rest of the women MPs that you will meet and other leaders. Next time, let us know who to invite. Let them come. One by one, we'll transform them. I know we'll not change everyone, but one changed is one too many.
There's one aggressive lady who buys in Madara in the room. Where is she? That wonderful lady is my guest. Please stand up. That lady is a politician in Mathare, Nairobi.
Mm-hmm.
And she's been making a lot of good vibes on matters women. Please incorporate her in your small circles?
We will. Now that she's here, she will not go unless she's incorporated. So, Mheshimiwa, thank you so much. We want to release people to go for lunch because we still have a session onwards, but we'll need to have more meetings where we can come and listen and speak more. And thank you for inspiring us that you're actually taking action. You see what we see, but we'll continue bashing you because you are there to represent us and others. So let's commit to, I commit to bashing you. When I see people coming to New York to do shopping, when I'm running from one room to the other, pushing for whatever, I will call you out. And I will tell the rest of the Kenyans to call you out.
In a land far, far away, in the village of Hemobut, among the Purko clan, before the sun rose, the orange orb of its rays filtering through the grass-thatched houses of the people. Lemoit rose from his bed, feeling dark and lonely. He left and went out to refresh his kidneys. And as he got beside his home, there they were, two unmarked graves, one bigger and the other one smaller. The bigger one belonged to his wife, the wife of his youth, and the smaller one belonged to their daughter, whom she had known would be the apple of her eyes. She had believed he would carry this baby in life and love, hope and joy. He went on his knees with a pang on his belly, and as a man of the clan, his tears did not fall, but his heart had torrents of tears rolling down to the grave where his loved ones had been laid. He woke up feeling disdained, disillusioned, discouraged, disjointed, and ashamed of his life and the events that had led to this day. A few days earlier, he had been woken up in the depths of dawn with a yell from his wife, crying for help, saying, "Now is the time." He looked, and her water had broke. They were quite surprised because they didn't know this day had come. He picked his phone and rushed with it outside where they would always catch the network, and there was only one bar, but it was too weak in the infrastructure of their place to sustain any call going through. He looked down, crying what would become of this day. And then he had a beep on the phone to look and only see that the single bar that was left was warning battery low. For he had gone 5 kilometers away to charge his phone. But that was the day there was a national blackout. So he went back to his house knowing he would try again the following day. And then his wife cried again. The only midwife he knew had been arrested the week before. He looked for a friend, and they went and picked a wheelbarrow. They put her on the wheelbarrow and began walking with it as fast as they could to the clinic that was only 5 kilometers away, praying with every step of the way as the wheels of the rickety wheelbarrow made its way. They arrived at about 7 in the morning. but the clinic was closed, for the only worker there was a nurse who had worked late the previous night. She was the midwife. She was the doctor. She was the accountant. She was everything. Despite that, the nurse still made her way to the clinic by 7:15 that morning. But she could not attend to them, for there were 3 other mothers before. And with the help of some women, they tried helping deliver these children. Finally, they came to her. They asked her to push and saw the baby long coming out from the cervix. And they pulled the baby and tapped him on the back, the stomach, the chest, but there was nothing but silence. He picked his child and raised him to the gods, as if sacrificing blood of his blood, flesh of his flesh. Unto you I return this soul. When he looked back, there was blood all over, drawing to the lifeless body of the wife who had just died from postpartum hemorrhage. Hundreds of kilometers away, there was a woman who had been told that laboratories were not working. Hundreds of kilometers away, there was a man who had been kept in the dark until much later he heard that the wife had died. Hundreds of kilometers away, in the same country, a woman had been told that she was too old to cry in labor, and she bled to her death. Hundreds of kilometers away, a woman had been told to go buy scissors and cotton. All of them lost their loved ones. Their nights were long. They tossed till dawn. Their days were quicker than a weaver's shuttle and came to an end without hope. They cried in the sorrow of their anguish. They mourned in the bitterness of their soul. They said, God, God, what did we do? And so we rise today to challenge ourselves, to ask, to listen, and then to act, and to give the women of our land that they need. The ABCDs of the needs of the women can go up to Z. A, to act and offer them access to medical care. B, to be there for them and allow them to be. To care for all their needs and to offer them dignity during childbirth. E, to empathize with them each and every day of the way and be friendly, faithful, and fun as we listen to them. They are good people, and it is our call to be helpful to them. Injustice in our land and indignity to women must be turned away by ensuring inclusion and justice for the people of our countries. It costs nothing to be kind. It costs nothing to listen and love. It costs nothing to realize that it is meaningful to hear each and everybody who speaks. It costs nothing to be near them. It costs nothing to offer women the opportunities that they need to grow and glow through the days of their lives. It costs nothing to have political will and ensure that policies and programs that women require are there to help them bring to life that they have been called to do. Quality is key. Respect, support, trust, understanding, and us not being violent against them, but vigilant with every step that they make, to consider their well-being and be zenal through it all, yearning every day for the quality health care for our women with zeal and zest. This is my story. The Lord bless you and keep you.
Tumpigie makofi vizuri jameni. You guys have your group leaders.
And I think that sets the tone, the perfect tone for the next session for group presentations. So we will start with group one, the group that was at the farthest end.
My name is Angelica Ndeto, woman with psychosocial disability representing Kenya Women, Kenya Network of Women and Girls with Disabilities. We work in several counties, working and fighting for women, especially on gender-based violence, sexual reproductive health, and other things. Allow me just to read as we've written so that it can be, we can use the least time. Turning the tide, acting to address the gaps. We have the gaps, then the solutions. What would you have done differently to solve, to save lives? 1, always seek professional advice to help in detecting of any health challenges women and girls encounter. We had one of us who said that when you don't have the professional health information, you end up having challenges and even get, maybe it becomes a disaster. Availing information, early sensitization through community engagement, media, social health and programs, especially like the lady who had, it's recess negative, because there is a time in Machakos we had a conversation and the outcome was like, even in schools, girls and boys need to be told, even when they're having maybe like when they start their relationships and all that, you need to know yourself and know your partner very well before even you can engage in any other friendship and all that. Advocate for community communication skills among health practitioners and soft skills training. Health practitioners to be more experienced in facilitating the sensitization sessions at the community level, and especially the community health promoters. You find that some of them even don't have the right, or they don't have even the information, and then you never get to get the right information and it becomes an issue. Government to bring health facilities close to the women and girls to allow easy access of services, situations of long distances, challenges to maybe like end. Because if you find that, as one had said, the facility is just outside, it's easier, even if it is 5 kilometers to where you're going. Ensure all stakeholders are involved at all levels, from the women, healthcare providers, government. We need to have a system in place, bringing up all the stakeholders on board. Strengthen advocacy on maternal health. Then the budget came up, implementation, so that without money there is nothing much can be done. Social accountability of the deaths, maybe data mapping and all that. Coordinating of programs. So we summarized all these two: accessible, available, affordable, and quality access health services. Thank you.
Oh, that's great. And we are very equitable as MCs, so we added 1 minute, but she was very good. Group number 2. Okay, you guys, clap for her. Group number 2.
Thank you very much. I think our group was thrown into the best of what I like in my life about women economic empowerment. And so we were looking at the broader picture of women economic empowerment and broke it down. Okay, at least the White Ribbon team broke this down into smaller pieces for us to chew. So the first question was to look at what does that look like? Women economic empowerment, it looks like. And in our deliberations, our discussions summarized what women economic empowerment looks like as the women, if they have access to productive resources. You and I know that if women have access to productive resources, I know there are no useless resources, but if they have access to that and they can make decisions about how to utilize the resources, then they have what we call economic emancipation or economic freedom. And therefore, that ushers in to the next question that we were tackling around how economic empowerment would go on to improve MNH, or maternal and neonatal newborn health. And some of the comments that were coming out of our discussions were, women can make life-saving choices without prejudice, without being cornered in a position where they need to seek validation or permission to utilize resources, because they can say, the treatment that I've been given in this facility is not worth it. Let me move to another facility. That can only happen when the women are economically empowered. And basically that means that they have some disposable income or resources in their pockets that is backing that foundation of making that choice or decision. We discussed about the delays, the 3 delays in access to health. But I think what we are coming up here with is that when women are economically empowered, somehow, magically, I don't know if there is a magic chronometer to measure how the magic will look like, but there is a way that reduces the time within which these delays do happen. And actually, I think one of our members said that we can eliminate all the delays when women are economically empowered. And I think for us, our call for clarion call is, wherever we are, let's empower women. Let's try to push women. I know you want to come here, but let's try to empower women economically.
Let's clap for Philip.
Thank you.
Another clap for Philip. Group number 3.
Thank you. Group number 3, we came up with we were looking at the gaps, and we used the model for 3 delays in maternal health. And delay 1 is decision for women to seek care. I Under these, we realize that most women are ignorant of available services. There's also that issue of low status of women in the society, poverty issues, the issues of culture, especially when women have to wait for someone, maybe in the family, like the spouse, to make decision for them to seek for healthcare services. And also the previous poor experiences in the healthcare facility may make them delay in seeking care. We also looked at delay in reaching care due to distance, a case in point of one of the cases on the board, because of the distance to the whole health facility, the poor road network, and also issues of the terrain. The third delay was delay in receiving adequate healthcare services. And if you look at these cases here, most of them are due to the inadequate or quality issues in healthcare. Like if you have poor facilities that lack supplies, like drugs, blood, inadequate trained staff, poor motivated staff, poor communication systems within the facility, and which maybe leads to either inaccurate or inconsistent information that is given to our clients. So these were the delays that we identified. We also identified another fourth delay that is related to community social support, whereby communities are supposed to come together, support individuals in terms of organizing for transport, etc. So what were the solutions suggested? Capacity building for healthcare workers on EMONC. EMONC is emergency obstetric care, respectful maternity and self-care. So ensuring that staffs, especially the midwives, the nurses, the doctors, have these skills. Then we need to strengthen follow-up of pregnant women and postnatal women, right from the community levels. Empower women economically. We empower women in terms of knowing what their rights are in RMNCH, empowering them to know when to seek professional care. Motivate staff working in the RMNCH space in order to improve their attitude. And also the issue of leadership and governance, right from the national to the county levels. So they need to prioritize on key areas like staffing, development of staffing, and also deployment. Funding, improved funding on RMNCH, advocacy. We also need to support, to come up with a support system for men, because we realize that men are usually left out.
Let's clap for group 3.
Sessions.
Let's clap for group 3.
Good afternoon. I'm cautiously looking at the time. So we were looking at 2 questions. How are we listening? And what we can do in our capacity to make things better for women. So on listening, we discussed that we need to create an open platform where people can share their stories, and this is one such, and also let our clients know what their rights and responsibilities are so that they can feel free to share their stories. And importantly, we discussed the need to advocate for open communication between the healthcare worker and the client, so that provision of services is collaborative. It is not directions from the healthcare worker or what the client only wants, so that people can work together. So sensitizing both the healthcare worker and the clients, which involves a lot of active listening. The second part, what we can do in our capacity, focused on the health systems blocks. We need to strengthen service delivery, health worker development, both those who are already in service with trainings, but also strengthen training institutions so that when people graduate, they have the competencies that are necessary. Improve information systems. One of us talked about the importance of data in decision making, and then availability of essential medicines, strengthening health systems, and we had noted the need to reprioritize resources so that instead of focusing on buildings, we can be able to focus on services, and also advocate for good leadership and governance. And then finally, on community strategy, that we needed to strengthen community strategy under primary health care.
Hi, my guests. How are you feeling? How are you feeling? I am sure if it was something easy, we would have left by 10 a.m. I know it's not easy, but it's doable. Sindio? Now, a few weeks ago, was it a month ago, the gentleman that you've seen here, he has been a friend of White Ribbon and a friend of mine. And by the way, he's the director of World Customs, who has just landed from Atlanta, Georgia. He left yesterday and told me, Angela, there'll be jet lag, but I'll be there because I care about the issue. First, clap for him. How was his spoken word? Larry is amazing. I had not told him what it's all about, but he's a creative, remember. He's many things. He's a very good friend of mine, but friend to the cause. So he calls me and tells me, Angela, we have to talk. I'm like, okay, Larry, I've not seen you in a long time. What is this? Niko na deni na sijui, ama niko kwa CRB. Then he said, no, I want to introduce you a very good friend of mine who is really concerned and has been following you and would want to get in touch with you so that we see how we work together. And we planned, and then I'm like, who is this person? She's like, I'm sure. You remember that story, that song you taught me? I'm sure you will, if I tell you, you'll relate. But I wasn't, she had just reminded me the song. It's a very funny song that I will not tell you about now. So he tells me, I want you to meet Kambua. Then I'm like, which Kambua? Then like, the only one. I'm like, okay. So we had a meeting with Larry and Kambua and decided that we were gonna hold hands and walk this journey together. And we met not long ago and we have made it a reality. And so I want you, ladies and gentlemen, to put your hands together for one of the most amazing people I've met so far. She's humble. She loves God, like me. And she cares about the issue. But most importantly, she sings so well and has been a great host. Please put your hands together to welcome our newest champion in town, Kambua. Karibu sana. I would want you to stand here and say hi to people before we sit down. Okay. Yes.
Actually, before she does what? So it's a setup. Angela, you're joining them. Thank you, Angela. What a beautiful introduction that is. I'm really happy and honored to be in this room, in a room full of people advancing a conversation that's very close to my heart. You know, I keep asking who speaks for the women, who is speaking for the women. And I'm glad that we have that in common, that we are here to speak for the women. Sasa, niimbe nini? So you'll be my backup vocalist. Sawa. Tayarisha ko basi. Haya. Bado nasimama, bado naendelea, bado najikaza, nifike kule, bado nasimama, bado naendelea, bado najikaza, nifike kule, imba tena, bado nasimama, bado naendelea, bado najikaza, nifike kule, bado, oh bado, bado najikaza, nifike kule. God bless you.
Thank you, Kambua, and please join me. Thank you. I want to have a very short conversation with you. I know we've spoken before.
Yes.
I think you are even the first people to watch one of the documentaries. We watched it at Fairview Hotel. I told her you have to see this story. And from your own story, I don't know whether you're okay to share your story, or from your own experiences. I'm sure you've seen, you've heard, you've read. I've followed so much of what you discuss with women. Tell me, what do you think is wrong?
Wow, that's a loaded question. What do I think is wrong is, first of all, that we are not talking enough about the issue at hand. Because Angela, I remember when my introduction to motherhood was after years of infertility. And you know, we always imagine when the time is right, I'll get married, I'll have children when I want, and then, you know, I'll raise my children, and we have beautiful plans, right?
Kambua, that is called the Simon Makonde story.
Like
what
everyone,
is this? The Simon Makonde story says that you are supposed to live you are not supposed to have any issue.
Yeah.
You're supposed, it has to
it's
be
a straight line.
Yes.
And that's what I imagined my life would be. So, you know, going through those years of infertility, and then finally getting pregnant and having a miscarriage was so shocking for me, because I didn't know, even though I had heard about miscarriages, I didn't actually imagine I could experience it, you know? And it sort of threw me into a world that I didn't know about. But when I had a miscarriage, I remember my friends who came to see me and family and the people who were close to us, how many of the women I know who are close to me who said to me, Kambua, I understand, I've been there before. And I had no idea. I've known them for so long. And I thought about it later, and I realized that as women, part of the reason we don't even talk about it is there's so much stigma around loss, around infertility, so you struggle by yourself. If I get up, I remember a friend of mine who was very vocal about the miscarriages she had had, and she would talk about it on Facebook, and people would be like, you can't keep telling us about your dead babies. And at some point she stopped talking. So I realized that if I tell people I had a miscarriage, first of all, I have been trolled, insulted for years for being unable to have children. And people would say all sorts of things. And then now you get pregnant and you lose that pregnancy. I didn't know, who do you tell? And who do you ask? What happened? I had so many questions. Why did I have a miscarriage? And the first thing that a woman does when they experience loss is to blame themselves, because we imagine that I have one job, is to keep that pregnancy, right? My journey continued, and God did bless me with an amazing young boy. I got to experience what it means to be a preemie mom. I did not know what that meant. So again, I went back to Simon Makonde because I thought you get pregnant. You carry that baby for 9 months, you go to the delivery room, you push, congratulations, and we go home. And then the milk automatically comes. You know, I just had this picture. I didn't know a baby. My son came at 34 weeks. It was an emergency C-section. He was 1.65 kilograms. And I thought, I have never seen such a small baby in my life. So when I was sitting in the lactation room with other preemie moms who had babies in the NICU, I was so embarrassed, you know, because people, okay, Toto, you send a text message, praise the Lord with us, baby Nathaniel has been born, 4.0 kg, you know. As we were like, he text tutatuma aje, utambia nani mtoto ni 1.65. There were so many layers.
Wangesema, you know, Kambua is a musician. Maybe she was keeping her weight, she didn't eat.
Exactly. And you know, and that was the story, even hataki kuzaa sababu, she wants to keep her body, you know. And then uzae mtoto mdogo aseme, you know, so there was so many layers to peel. But then now, going through that journey of the NICU, taking care of a premature baby, he's fantastic and thriving. And God blessed me with another baby who lived for 2 days. And my journey with Malachi, again, opened me up to a different world that I was unaware of. And I remember going through, I think it was the darkest time of my life, and having so many questions, because I thought, it's been so difficult on this journey. So difficult. And being a believer, I said, but God, the least you could have done is to let me keep my child. And I didn't have the answers that I needed. What went wrong? Everything seemed okay. And then suddenly we have a crisis. Why do we have a crisis? And I know that we keep talking about a lot of the losses that happen maybe out in the village or in the public hospitals. I was in a private hospital. And the crises happen even in the best of hospitals. There's negligence even in the best of hospitals. And I had questions that nobody could answer, you know? And I think that losing my son, as painful as it was, awakened me up, because I realized that women and children are falling through the cracks. Women and babies, we are falling through the cracks, and no one is asking the right questions. And the people that we can ask, no one can hold them accountable. They protect each other. So, you know, and I thank God I went through the journey, and I had another baby, and she was the first pregnancy that I was able to carry to term, because my son that I lost, I had him at 36 weeks, even though he was a little bigger. He was 2 point something. Nilikuwa nimejaribu. You know, I can laugh about it now, but it's still a painful part that I reference to. I feel that I did my clinics, Angela. I did everything that I was told to do by the book. I listened to my body. You're told to listen to your body, listen to the baby. I did everything that I knew to do. And still the outcome was not what I imagined or what I desired. So what is the problem is what Angela is asking. For me, I feel that the problem, first of all, is that there's not enough noise about the lack of information for women. There's not enough noise when there are cases of negligence. There's not enough noise. I'm glad the Mheshimiwa was here earlier on. There's not enough noise with the leaders that we have entrusted. So the problems are, I guess they're diverse in nature, Angela.
I think you've talked about leaders from your point of view. And from what I know, leaders are supposed to care and influence change. Do we really have the right leaders doing the right jobs? And if not, why do we have the wrong leaders? Who is the issue? And as you're thinking about that, because I don't even think it's something that you can answer, is you've talked about listening to women. And what we do at White Ribbon Alliance is start by listening to their issues. And every time I tell people about we ask and listen, they're like, but we already know their issues. Then I keep telling them, but it's the wearer of the shoe that knows where it pinches most. Even as we're pondering through about the leadership bit, because it's a big issue, we know we don't have, even I know the answers we don't have. You went ahead to start your podcast, Being Kampua. And what I remember very well what you told me is that you were giving a platform to women to speak out. Tell us about that, because many people still don't believe in the power of just listening to people and letting them speak. Not to respond, but to just understand, hear them out, and start from there.
Yeah, you know, you've said it right, because many times people want to prescribe solutions and they don't know what you actually need. You know, for instance, I'll give you an example. When I lost my son, in that moment, I'll tell you a little bit of what happened following the minutes after losing my son. I remember a counselor walking into the room and she said, I'm very sorry for what has happened. Do you care to tell me, can you tell me about what has happened? She has her notebook, she's ready to write notes. And I'm thinking in this moment, my world has fallen apart. I can't even make sense of what's happening. For me, it was not the right time to come and tell me what has happened. It felt very insensitive. It felt like she just needed to tick a box that I have seen her and I have, you know what I mean? I said, if you ask me now, as a mother in that position, I would have wanted this, whoever she is, to have been involved with me from the point that they realized it's a crisis with my situation. She should have been a familiar face so that when it's happening, she wouldn't even need to prod me to care to tell me what happened. She would have been in the process, and she would have been somebody that I trusted. But at this point, I did not trust her. If you ask me what I need, I would tell you that when I lost my son, I did not want to be in a maternity ward with other women who have children who they're still nursing, so I can hear babies crying. So those are the things that I need as a mother who has lost a child. is there provision? Can you provide a ward where women who have had a miscarriage or a stillbirth or can be separate from the mothers who are going, sababu wengine watakuja kuamsha kuambia twende tukanyonyeshe. They don't know that you've lost a baby. So why I started being Kambua is for the women to say these things, for people to hear that this is actually what the women need. And because I can only be the best advocate for myself. And so can you, and so can you. You know where the shoe fits and hurts. So giving women that place to say, this is what I've been through, this is what I wish could have happened, has been so powerful because, and I get a lot of messages from doctors and nurses who say, because I think part of what has also been missing has been the humanizing the process. You know, you mentioned dignity earlier, Angela, and just the women who come and say, I wish they were gentle with me. I wish they broke that news differently. It's such a common thread. And so when they come to my inbox, and it's okay, I appreciate. I say, ni sawa kujeni na kwa inbox tuongee. Even Nicodemus went to Jesus in the night. So they come and they say, thank you for the conversations. We are learning to be more sensitive with our patients. We didn't realize that a lot of them have their hearts in the right places, but you can imagine if from 8 a.m. to whatever p.m. you're seeing doctors, it becomes routine. And you can easily lose that utu, you know? It becomes, it's like a, ni kama mteja, huyu aende, let's go to the next one. And they realize we need to put back that touch, that care, that dignity with the patients that we handle, regardless of who they are or what they are going through. So, this platform has been so important for women to realize, oh, okay, we can talk about these things. I can talk about how a miscarriage affected me, because it doesn't just affect you physically, but mentally, and it can happen for years. There are women who say, it's been 10 years, and after listening to so-and-so, I have found closure for the miscarriage that I had years ago. Or our family is able to have this conversation. Or I realize that I can go and get help for this condition. So it's a safe space for women to talk, basically.
That's powerful to hear. And I'm glad to hear that we have allies in the room, because every time even when we go to donors, we go to the ministries of health, we tell them, can we stop just looking at it from a very mechanical point of view? Can it start with the users? And I think a lot of times you've heard us say that the users of care, the mothers, the families are actually the real experts, because they're the ones who know their issues, and they also have the solutions actually most of the times. And I think keep on doing what you're doing, because for me, listening is the first step to either solving or healing an issue. And now to the last thing, because I know we are running out of time and we have people who need to catch the flights and the like. Do you think that change is feasible? Do you think by sharing those stories, there is hope? And I say that because I believe there is hope. When I started this journey many years ago, when I used to work in South Sudan, just when I left campus, I cried so many times. In fact, when Larry was telling about the story of the guy, I think I keep reminding people and telling people the reason why I started this is there is still a story or a picture of the guy who, somewhere near the border of South Sudan and Congo, who, the graveyards are very fresh in my mind. There were 3 and the wife. So there were 3. In South Sudan, what they do, they put stones on top, and then so this guy tells us to go to walk there, and then he breaks down. It's like my wife died in the health facility. And I think that stuck with me for years. And I think that is what really drove me to start what I started. And as you're talking to these women and as you're telling them, do you feel like change is feasible? Personally, I feel it is, because at least we have so many other people following. Many people are being converted. Today I was talking to one of the doctors who was around, and what he said was, you know what, Angela? It's good that many people get to hear this. Many doctors, many nurses, many county people, many policy people, many donors, because this is the reality. This is actually the whole picture. A lot of the times the numbers are mechanical. And for me, that is change. Do you think, from your own perspective, from these women, do you think change is possible? And how much longer?
change is definitely possible, and I think that even the fact that we are sitting here having this conversation is change that's happening, you know. And I agree that, you know, when we leave this room, there's more advocates leaving this room. The more people you keep telling and having these conversations with, you know, that it shouldn't end in this room at Pan-Africa Hotel. Go have it in your home, in your small groups, in your offices. That the more we continue to have this conversation, the more awareness that we are creating. You know, you'll be surprised that there are people you will tell that mothers are dying, and they'll be very surprised. You know, they'll be surprised by the numbers, but they'll be surprised that it happens at all. So it's having these conversations and having it and letting people understand how serious it is, that one mother is too many mothers to lose, but we're losing them in the hundreds or the thousands. It's like a pandemic, you know what I mean? That we are too many human beings dying of something that can be controlled or something that can be stopped. As we said earlier, pregnancy, it's not ugonjwa, yeah? And congratulations, there's a beautiful pregnant mommy in the room. It's not ugonjwa, but it's also a very thin line between life and death. And if we understand the sanctity of life, then everybody would play their role. And I think that if we keep holding each other accountable, we are first holding one another accountable, getting the right help. If as a woman, I am pregnant, seeing the doctor, doing what is required of me, holding the doctors accountable, holding the leaders accountable, everybody plays their role, then definitely we are going to see less and less of these stories. And I hope we can get to a place where when we hear one, we are like, what, where, you know, like that, it will shock us. But I think that it's been happening so much that at some point, it's almost like we became, what's the word for it, Angela, where we're desensitized. Yeah, it's like we're desensitized. We're like, oh, it's another point in the news. I think it needs to shock us. Each time a mother dies, each time a child dies, each time a baby, you know, I interviewed a lady who had a beautiful, normal pregnancy, no complications, went for her delivery, had distress during the delivery, and it was a case of negligence. And she labored for so long, so the baby lost some oxygen. The baby was put on an oxygen tank, but even on the oxygen tank, the baby seemed to be struggling. And it took her pastor's wife coming to see her and said, something is wrong, we need to change. And they moved to Kenyatta Hospital. The receiving nurse at Kenyatta, because the baby was still on that oxygen tank, said, but this oxygen tank is not working. So for a day and something, the baby had been suffocating, having lost oxygen already. So this baby will have CP for the rest of her life, for something that could have, if someone had just paid attention. So I believe that change is possible, but we have to hold people accountable. We have to keep asking the right questions. Yeah.
Thank you. And I think even as we're thinking about holding other people accountable, we need to start by holding ourselves accountable. I want to applaud the 3 counties that are here because I've seen a journey, I've walked a journey with them. One of them is Bungoma County, Kakamega County. Where's Bungoma? Kakamega County and Kisumu counties. Oh, wow. I'm not saying that the rest are not working, but have you started a journey with people who are not understanding what you're doing, but they just say, let's just walk. Yeah. But now they are the propagators of respectful care. The midwives, the county departments and everyone. The Vihiga, oh my God, I forgot you. How, Abigail? Like people who have been walking the journey and actually seeing the power of health literacy to the people, self-care to the people, respectful care. And for me, starting with at that level is really powerful because it's at the community, it's at the county, but also it's at the facility level. And for me, that is really key. And even the rest of the communities, the groups of people that we are working with in the informal settlements, in the communities like Eve, Florence, who is here, and so many other people, Joseph Ojuki, who is sitting right there, really advancing a cause that is really powerful at whatever level because it will take a concerted effort of all of us. And the media, I really want to first salute the 2 MCs. They have been champions for White Ribbon for years. Angel and Mercy Kandie. I don't know, I think now that they are not on the mainstream media, I think the people may have forgotten. That is Angel Katusia, formerly of KTN, Mercy Kandie, formerly of KTN, Citizen, and BBC. We have Wanja Mbudia. Wanja, you are hiding, but I can see you. Wanja writes powerful stories in Nation. Media, and so many other media champions that have been here that have really believed in the cause. So I believe it's possible because it is possible. And I believe what I'm hearing from you, if we can only listen more, introspect, act more, but most importantly, hold ourselves accountable and move as one, we will achieve change. And as we are leaving this platform, what is your last one message to all of us?
My last one message is, I'll echo something someone said earlier, that this is not a White Ribbon Alliance thing. It's an all of us thing. It's a responsibility that we all have to ensure that our mothers and our babies receive the best care. And I think that if we personalize that and take that responsibility upon ourselves as individuals, then change is imminent. In as long as we imagine it's only Angela and White Ribbon, then it's a very, very long journey that we have. But if we each play our role, then we are going to make progress even faster than we imagine. Yeah.
Thank you, Kambua. And as we close, I want to take this moment to first acknowledge a few people who've really believed in the cause and the stories behind this. One is my former colleague, Sandra Marania. Stella Maina. Morris Babu. Angel again. I don't know whether Rama is still there. I think she left. And the entire White Ribbon crew. Honestly, I think every day they keep asking me, and they have kept asking me even in the past, will we make it? But I think what I'm hearing from you is that it's possible, it's doable, and I think it's a commitment from all of us here that it's doable. So I really want to say thank you. Congratulations, keep up what you're doing.
Thank you,
I am
Angela.
going to walk the journey with you. I am going to hold myself accountable.
Yes.
Let's do it because together we can.
Absolutely.
Thank you, Kambua.
Thank you, Angela.
Thank you very much. Welcome to the Championwood. We were 12, now we are 13. We are at the tail end. Watch hata MC wapigwe picha. Thank you very much. So we're at the tail end. We came here for two things. We've had beautiful stories. We'll continue hearing beautiful stories. But over the last few years, maybe 6, 7, White Ribbon has been doing research on several things. But they are all interlinked. And I'm very happy because I can see one person, two person related to almost each and every report that has been done here. So everybody who knows we started with What Women Want. That was in 2019. I can see Eve, I can see Florence, it's exciting. Then we went to 2020 at the height of COVID, and we did a research to understand what the effect of COVID on women, and particularly on maternal health at that particular moment, was. Because we had curfews, but birth does not wait. You know, so we listened to women in different counties to hear what was the effect of COVID on their life, on what they were experiencing. Then we came to what newborn wants for quality care, because what are mothers without their newborns, you know? So we wanted to see what are the gaps there. Then 2 or 3 years back, we went to the midwives. We wanted to listen to the healthcare providers, because everybody keeps on saying, oh, madaktari, oh, nurses. But we wanted to hear, why is everybody saying nurses? So we wanted to listen to the midwives and the caregivers who give women care. And we produced a report that is called The Midwives' Voices, Midwives' Demand. I'm happy to see Catherine, all these Bungoma, Kakamega, Vihiga people, Kisumu, thank you very much. And I think last year, Sandra led a campaign that was, what does respectful maternity care mean to women and girls? Because when we asked women what women want, the first response was respect. It was not facilities, it was not nurses, it was respect. So we wanted to understand what is actually respect. And if you read this report, respect meant diverse things to women. It meant to be called by their names when they go to clinic. Hii kazi ya kuambua next, you know, we have names. I'm Angel, she's Catherine. They said they wanted to be attended timely. If you tell me clinic is at 8, why as a specialist are you coming at 12? So it's the simple things that we never thought women cared about. And therefore today we are presenting about these 5 reports. They're accessible on the White Ribbon Alliance Kenya website. If you are lucky, you might have grabbed a copy. If you are lucky, they might still send a copy to your office. Get to read them, get to see how intertwined these things are. Angela keeps on saying that maternal health and reproductive health care is not, what do you say? A health issue. You know, it's an IT issue, it's an agriculture issue as we heard about nutrition. It intersects with almost everything, and currently climate change. So we are going to invite Angela to invite a few people to this side, the last time we were that side, to launch these beautiful reports. And I hope you guys will have a chance to really read them. They are very beautiful reports, voices of people, women and girls that have never been given an opportunity to be heard. And Angela gave the vote of thanks even before it was time for vote of thanks, but we will still give vote of thanks. But I'm really happy and honored that you guys have still stayed with us up to now. We don't take it for granted. And DJ, please changamsha. You know, like, wapatie beats.
It's the climax,
it's a climax
of the day.
Hata kama ni kudance, tutadance.
Hi, I think, let me see. Yes, Moses, come. Who else have not gone? Abigail.
Can we have the county representatives at least? Let's have the county representative. Picha ikikupata itakupata.
Yes, and let's be upstanding and dance to the beat even as we get to the tail end of the really good event that we've had today. Do we have a countdown for this?
Do we have a countdown for this? Musikate kwanza, naona mko excited na makasi. Mukisikia tumesema 0, ndio mtakata.
We're waiting for the countdown. We're doing it in style. So we're ready for you. Cue the number.
When we say 0, you cut. Stella unaitwa hapa. Oh.
Okay, in 5, 4, 3, 2, 1, 0. We have the physical reports which will be available for each one of you.
Cameraman upige picha mzuri, kila mtu atokea kwa kamera.
Remember, Immediately after the event, you'll be given each a flash disk that has all these reports in soft copy. Into a sound.
So let's do this. Let's have a champion. The count. So this photo is full. This photo is full. I'll call the rest. Please tighten up. Mpendane. Yeah, so that is tight and good. Eve and Angela can sit. Eve can sit. And then we tighten up to get a beautiful photo. We all will have an opportunity to get photos, please. Larry.
Get your feet happy. Let's go. Come on.
Okay, smile. Look at the camera. Usishake sana mtatokea hivi. Making sure mmesmile poa. Thank you very much. Cameraman lady, tell me when you're ready. Thank you so much. We'll have more opportunities for photo sessions with this.
Come on, Jehovah, say it. Jehovah, you. Say it.
Angela, you want another photo? Camera lady, when you are ready.
I trust, say it. Show me how to do it, y'all. I believe, say it. I believe you. I trust. Come on. In you. Oh, Lord. Come on. Jehovah, you. Where y'all at? Come on. I trust in you. I believe, say it.
Thank you very much.
On behalf of the team, White Ribbon Alliance Kenya team, we are a small but very dynamic, very passionate human beings you will ever put in one small space. So what I want to say is thank you very much. I think we are all here, if somebody is not here. Yes, including here. So in case they are not here, but this is on behalf of all of us, is to say thank you. I want to first of all thank you everybody for showing up, getting the invite, honoring us, showing up today. We are very excited to see you. When each one of you walked in, you've stayed with us. We want to say thank you very much for that. Please let's appreciate each one of us for showing up today. We want to say thank you for the partners, and when I say partners, we have our whole multisectoral partners. We have our donors, we have people in the medical field, counting all the partners who are with us and work with us and continue to, like Ambua said, to speak and speak and speak louder about this. We want to thank all the people who may not be here with us, but we have seen their stories, the mothers, the newborns, the fathers, the families that have shared their stories of everything. We want to thank them even if they're not here with us. We also want to thank our other partners, the media, the service providers who brought our vision into what we can see today. Some of that was something we knew either in a report or in our head, but they made it possible. They worked, they were patient. We want to thank you. We also want to thank you. In case I've left out somebody, please forgive me, but I just want to thank everybody who made this happen, whether in support, in prayers, in the presence, even the hotel, I think they've taken very good care of us. And thank you. It is now, yes, we want to thank God Almighty. We also look up to the giver of life, and we want to say a short prayer. Do I still say the prayer, or do you have a pastor?
Sandra can say the prayer.
Sandra, you can.
She can tell us who she is.
Oh, sorry, I didn't thank Christine. I really forgot to thank this team here. I just said we are passionate, but each human here you see here has a deep passion for the movement, but also the effort they have put to make it possible. I don't even know whether I'm going to say by name or what, but just say your name and say thank you or something very briefly. Just introduce yourself.
Hello, my name is Tali. I'm working with the program's assistant, and thank you so much for being here.
Hi, everybody. Hi. I know we've talked with most of you, in this organizing event, but I am Andrita Njambi, a program associate, really passionate to amplify and to reignite the power in women and girls.
Hi everyone, Lillian. I'm the finance manager at White Ribbon, and we're excited that you guys were able to come and join us today. Thank you.
Hello everyone. My name is Maurice. I'm in the creative. Thank you.
Hi everyone. My name is Kelvin Ngeno. I'm working at Finance and Operation Assistant. I'm so excited today. I think I can't say much. I'm so excited. Keep coming. And let's make maternal and newborn health a daily run-of-mill affair. Thank you.
Hi everyone. My name is Maureen Kitutu. I support programs, and thank you for joining us today.
Hello again. My name is Sandra Morania. I'm with Amnesty International. I head the Global Children and Youth team. Formerly, I had 2 journeys with White Ribbon Alliance as a head of programs, immediate, but then I came in as the advocacy and program manager, which through that platform I grew, not just as a person, but as a collective in the cause for mothers and children. I have 3 babies under 5. So this is a very close passion to my heart, and so I really understand the stories that are very intimate, very personal. And so thank you so much, Kambua, and everyone else who has shared their stories. It's not easy. It's not easy to share those stories. I now would like to give to our mother.
Hey, I'm the latest Gen Z. Yes. I am the Gen Z. I am the main servant in the office. I'm the one who serves the rest.
I'm Angel Katusia, and I'm a friend of White Ribbon Alliance. I work somewhere else, but that doesn't matter today.
Hi everyone, my name is Wangari. I work in communications, and I was so glad to take in pictures of your beautiful faces. Yeah, thank you.
There are people I want to appreciate. Wanja, she's really been our supporter. Moses Mita, Joseph Ojuki, and Florence. Not forget Eve. You've been really, really strong voices behind what we do. Thank you so much, and God bless you. And Gertrude also. Yes. I would want to ask a lady this time round to say the grace for us and ask Mother. Oh, go Wambe. Actually, it was meant to be Sandra. Sorry, Mother. Pray for us on Monday.
All right, let's bow down and pray. Heavenly God, we come to you this evening with thanksgiving in our hearts, thanking you for ordering the steps of White Ribbon Alliance, thanking you for walking the journey with us, thanking you for all the mercy, the grace, and the love that you've poured into this project. We are very grateful that today has happened, that we're able to tell the stories of mothers, of families, of babies that have gone through a very difficult path in this world. But we know at the end that the battle has been won, that you are in control, even in the journey of despair and hopelessness, in the journey of speaking out, in the journey of wins and joy, that you're with us. We pray that as we close the day, Lord, that the plans and the commitments that we've collectively shared, that you bless them and that you guide us ahead, and that they come to fruition in ways that we cannot imagine. Thank you, Lord, for this collective community. May we continue being close, connected. May we derive strength from each other as we continue in this cause, that we are able to also figure out the walls that come against us, the obstacles that come before our way in our advocacy effort. Kindly open our eyes, kindly give us strength to overcome these obstacles so that our commitments, our plans, our vision, our collective hope comes to pass. As we close the day and head to our various destinations, by road, by air, on the roads, if we're driving, kindly protect us, Lord, that we get to our destination, that we get there safely, and that our day comes to a close in the way that we desire. I'm praying this, trusting and believing in Jesus' name. Amen.
Thank you, people. Go well and see you soon. God bless you.